Close there, we're going to have a really interesting case scholar lunch today. First, I'd like to introduce myself. My name is Nushin Latour. I'm a communications manager at CTSI. And a few months ago, we sent out a survey through Chris on various topics around social media, and we wanted to know what you were interested in. And a lot of people were excited about learning academic research blogging and using social media to amplify your work. So we have two great guest speakers. I'm going to introduce them shortly. This bootcamp is also going to inform a potential campus-wide social media pilot series. So based on your feedback and how everything goes, we'd really like to continue this conversation. Secondly, I wanted to kind of bring up a few goals we have for today's event. The first one, from a CTSI perspective, is to help you identify your goals and reasons why you'd want to engage in social media. Secondly, is it for you? Assess the many pros and few cons that are out there and help you make a better decision, what works for you. Because as you know, you can be a really active user or you could be a passive user and a listener to find trends in your research, maybe notice some redundancies, find potential people you'd want to collaborate with. And then thirdly, helping you build a strategy online, choose a platform that works for you. And of course, there's going to be Q&A. We want this to be really hands-on and intimate, so feel free to chime in at any time. And now I'd like to introduce our guest speaker. Alex Smith was actually a former case scholar, so he's a case scholar alum. And he's a clinician researcher on the forefront to integrate geriatrics and palliative care. Alex received his medical school training at UC Berkeley, UCSF's Joint Medical Program. He has an MPH from Harvard. His research has largely been organized around three primary areas: end-of-life experiences, patient-doctor communication, and cultural attitudes towards care. Dr. Eric Waidera is a clinician educator in the Division of Geriatrics. His main goal is to improve the care provided to elderly patients with severe and chronic terminal conditions through program development and educational innovations. He's also the director of hospice and palliative care service at SFVA and the program director of the Geriatrics Fellowship at UCSF. He also attended UCSF. So both of these doctors, scholars, researchers have created a blog called Geripal, and it's pretty active. They also use various social media channels to amplify their research and topics in their science and research area. And before I completely pass it over to you guys, I also wanted to just read part of your mission on the Geripal blog, because I think it really sums up their inspiration. Geriatrics Palliative Care, Geripal, is a forum for discourse, recent news, research, and free-thinking commentary. Our objectives are: 1, to create an online community of interdisciplinary providers interested in geriatrics or palliative care. 2, to provide an open forum for the exchange of ideas and disruptive commentary that changes clinical practice and healthcare policy. 3, to change the world. We aim to be inclusive. We welcome the perspectives of generalists, specialists, gerontologists, palliative care clinicians, and anyone else interested in care of the elderly or palliative care. Anyone who wants to post or comment is welcome. Great, thank you.
Thank you, Nushin. It's good to be here, good to be back, see a lot of familiar faces. We have a bunch of slides, but we don't feel like we need to get through all of them. And there will be a wonderful interactive portion. So that's me, Alex Smith, at Alex Smith MD. That's my Twitter handle. That's Eric.
At Iwadera. That's my Twitter handle.
And before this hour's up, you too will have Twitter handle. So let's take a poll and see where people are. So there are 4 categories here. Newbie, lurker, if you mostly view but don't add content to social media. If you've commented, tweeted, or posted, then you're a user. And you're a power user if you've posted to a blog or YouTube. So how many of you are newbies? Everyone has to raise their hand only once, but only once. Okay, so like 3 newbies. Mostly view but don't add. So you're a lurker. Okay. Raise your hand if you've commented, tweeted, posted. A lot of people, mostly Facebook, is that what it is? Or yeah. Other areas, okay. Have posted to a blog or YouTube. So anybody out there a power user? Oh, that's good. How many of you are on Twitter already?
Nice.
Wow, that's great. I don't think we've ever talked to an audience that's had.
No.
How many use it?
What's that?
Right.
Yeah, like even
I don't
like
use
I'm
it.
on Twitter, but I
Lurker.
don't use
Lurker.
it.
Twitter is a lurker.
Like probably
I
Twitter.
use it.
I don't even lurk. I just
Yeah.
have
You
it.
just
Like
have.
they
You just
said-
have an account.
Yeah, like
All right,
they-
so maybe we could help take you to the next level.
Like they send me emails, hey, you know,
Do
Twitter is
something.
still there.
Don't forget about us.
Yeah.
Well, good. All right, that's really helpful to know as we move forward. So, David Letterman is retiring, and so in honor of David Letterman, we have a top 10 list, but we don't have time to go through all 10, so we're going to make it a top 5 list. So,
Don't read the numbers because they kept on changing whether it was going to be 3, 1, or 10. The first reason that we were thinking about why people should actually do social media is that everybody's doing it. This works with my 5-year-old, so hopefully it'll work a little bit on us. But if you actually look at, so me and Alex, every year we go to our national meeting for palliative care, which about 3,000 people attend. Which is a really great audience for our national hospice and palliative care meeting, and every year it grows. So one way you can disseminate information is actually go to these meetings, submit abstracts, present. Maybe you get a subset of these people, but it's a good audience. We could also submit to our journal, which is the Journal of Pain and Symptom Management, which is the journal for AHPM. Bigger audience. We get about 4,500 people as far as this print circulation for JPSM. However, we're still missing a larger audience. So if you actually add 3 more zeros to that y-axis, you can see that these audiences kind of fall away. You get to the total where we're starting to look at JAMA's total circulation. So if you get a publication in JAMA, it has a print circulation, I think about 350,000. So sizable audience. Not everybody reads every journal, but it's a good size audience. You can aim for a larger audience than even one of the big 5 circulations as far as medical journals, like the New York Times. You can see you're starting to get close to 2 million average users, or average subscribers to the New York Times. Good, but if we add a couple more zeros to this y-axis, you start getting into the train of what we're talking about during this next hour, which is around social media. So Twitter, a lot in the news in the last week about active users, but we're looking at about 250 million monthly active users for Twitter. WordPress, which is just one of the blogging platforms that are out there, if you actually look at how many people use it per month, it's about 400 million, and this is just one of the blogging platforms out there. So Tumblr is another one, Blogger is another one. And finally, Facebook, which is a little bit off the chart here. I think the last count was about 1.3 billion people using it. Good. You're not going to be able to reach every one of these. These are the size of the audience that you could potentially reach with each one of these different circulations.
Great. All right. So the second reason to do social media is that you can do it. So, does everybody here have a phone or a smartphone with them somewhere? Okay. Pull out your smartphone, and we have a handout that's been distributed. Everybody have the handout? Everybody not have the handout? Everybody's got it? Good. So this is basics of Twitter. And if you don't have a Twitter account, now's the time to sign up. If you do have one, then please log in to your Twitter account, and we're going to have a live Twitter session, live tweet chat, right now. Okay. So.
But wait.
But wait.
I don't have anything so profound that I need to share it or want to share it with an audience that's potentially unlimited. So advocate for why little old Amy Markowitz should bother having @Amy at all.
So we will get to the advocating part. The first part that we're going to get to, though, is we just want people to get on and do it once. We will get to.
Just try it.
This is the hands-on performance.
Because then you'll know what.
What does that mean in terms of my publicly facing persona, such that I can be tracked by whomever? It's a real question.
Yeah.
It's not it wasn't just a tweak. It was
Right.
why.
So I
What
think,
does this mean?
I think there's a couple things. A, I could be tweeting right now at a case scholar meeting with Amy discussing. All of a sudden, your persona is on social media. You don't have to actually be in charge of it. I could be in charge of it by writing about being here. So I think one of the things to think about is who is in charge of your online social media persona? Is it you or is it going to be someone else? And I can tell you, if you Googled me 6 years ago, probably would have been somebody else. If you Google me now, you type in my name, top listings are actually everything that I've created. Same thing if you're interested in the things that I care about, I do clinically. You know, it's important for me to actually get kind of how I think about palliative care and how I think about hospice and how I think about geriatrics out there in the public domain. So I'm also helping shaping that message about why I think it's important. And I think that's one of the things that we were going to be talking about later on is one person always says if you're not at the table, you're on the menu. So thinking about how can we actually get our messages out there that we care about onto these sites that have huge circulations. Not JAMA circulations, not New England Journal circulations, but much larger circulations, so we can actually shape some of the messages that we care about.
I would encourage you to think about Twitter as more of a proactive social media site. So like with Facebook, it's very passive. You just kind of like put stuff out there. With Twitter, there's conversations that happen, like you're saying, constantly, and it's sort of like fast-tracked conversations that you can be a part of. That's really useful for people in our field. But it's also a really good way to get news and information. Like I'm kind of a lurker on Twitter, but I use it more. Like I have feeds that'll tell me like who's funding what and what type of things are trending in the field that I work in. So I'm kind of in the background, but I use it a lot just to read. So it depends on how you use it. It can be really useful, but you don't necessarily have to constantly be out there.
Could I also add an example? I mean, it's obviously important to be out in the world, but it's also important to be seen within your own institution. For instance, I became aware of Eric because of all his excellent tweets. I became aware of his blog. I became aware of Alex, etc. And so, I mean, just as one small example, because I knew Eric and I knew, you know, that he was a thoughtful person with interesting ideas. I made sure that he was invited to the School of Medicine Leadership Retreat and was part of the conversation there. So just as one example, I mean, it is important to be part of the conversation because other people are listening and they're paying attention to what you're saying, and it's a way of getting ahead in academia.
And those conversations are happening around us. We can either
And you
be
have to sign up in order to access them. I have to create a Twitter handle for myself in order to access all of this.
over the course of the next 40 minutes, we're going to be talking about why you want to be a part of the conversation.
But if you're uncomfortable at this time, you can also just sign up with like minimal information about yourself in your profile.
Okay,
So
fair
it
enough.
could be like Amy Test. Like our first blog was really just a test blog.
Okay,
Trying it out.
fair enough.
This is what the sign up page looks like. So if you're new to Twitter, you can sign up. You have to put in an email address, and you can do that on your phone. It asks you for a password and then a username. So, like, this is from a talk I was giving in Maine to a geriatrics group, and I found that like Jerry Maynor was actually free. So you can put in a potential Twitter handle if you don't have one already, and it'll give you some suggestions.
And the key is to make it short, simple, shorter the better.
And you can
Yeah.
change your handle if you don't want to.
Yes.
Right.
So imagine if you don't have one, just put anything in there and you can always change it later.
So these are some hashtags you could use. So a hashtag is a way of marking a conversation by sort of a topic area or a particular thread that people might want to follow. And some you might consider, there's a hashtag for case scholars, hashtag case scholars. One we use a lot is hashtag HPM. See how it's nice and short? Rather than hospice and palliative medicine, it's just hashtag HPM, because you only have 140 characters. So you gotta be conservative about
So you can follow the person or a hashtag?
Or you can follow hashtag if you want to follow a particular kind of conversation. Like if you want to follow news about case scholars, and you just
This isn't actually a
you can
conversation,
search.
it's a series of conversations that are had
Right.
on this topic.
On this topic, right? So you could search for hashtag case scholars, or medical education hashtag meded, hashtag healthcare social media is another good one that a lot of people follow. Anybody else have hashtags they use or follow regularly that others might benefit from?
UCSF?
Hashtag UCSF. Yep, that's a good one.
CBPR,
Uh-huh.
EBRN, that sort of stuff.
Uh-huh.
Conference hashtags.
Conference hashtags, yep. Hashtag Society General Internal SGM 14.
Things like cancer research or some of the cancer-related advocacy communities like BCSM, breast cancer.
Mm-hmm.
Yeah, the disease hashtags are really great.
Yeah.
So you get access to a great audience of clinicians, researchers, and e-patients.
Mm-hmm.
So like PCSM is pancreatic cancer social media.
Wait, so the hashtags are whenever someone else uses the same hashtag in their tweet, that
Comes into your feed or
comes into your
So you can
timeline.
follow people, and when you write a tweet, you can put in a hashtag, and the hashtag just says, it's just a grouping of, so it's like a search term basically. It's anything with, when you search for a hashtag HPM, any tweet that has hashtag HPM will come up.
I like to think of it as a topic.
Yeah.
It's a topic, it's a subgroup within.
But they have to use the exact same
Yeah.
wording.
Yes.
Yeah, so there's a little search area in the top of Twitter, and you can put in hashtag and then any of these hashtags.
So
Yep.
do we have a hashtag for this conversation here?
We're just going to use hashtag case scholars. It's on the top of the Twitter Basics handout.
It's like the last communication was in January, right? Is this the one that case scholars at UCSF?
I think so. I don't know.
That's probably
Kirsten
right.
used it, yeah.
That's the.
That's a group.
That's the, right, that's our account is the.
Case scholars at
That's,
UCSF.
right.
Okay.
Right. So there's this at case scholars at CTSI, which is the account. Kirsten,
Yep,
do you know
exactly.
who actually?
I do.
Is that you? Uh-huh.
Anyone else could though.
And then you have your own account too.
Yes, I do.
And then Talmadge is us. And then we're going to find out who's in the room because we'll all be tweeting. And we'll use the hashtag case scholars and we'll put it up on the screen so that you can see each other. Let's
That's
figure
why I
out
knew you
who's
guys
who.
were up
Let's
here,
get
because I
it.
just
Follow
saw
each
that
other.
I retweeted it, I was like, this is great.
But I kind of don't want to follow the hashtag case scholars because it might have like
Wait, so
Stanford case scholars. I mean, if they happen
But
to
you
use
don't,
the
you don't need
same.
to follow them, you can search them, just.
Yeah, you just search it. You don't actually follow hashtags.
don't
You
actually.
follow people.
Okay.
So but you can tag things with hashtag case scholars. So let's try this. So we're going to circulate around the room, and everybody's already starting to do this. If you could,
He needs a minute.
yep, we got time. So just sign up, and everybody tweet something. Remember, 140 characters or less, and include the hashtag case scholars.
So how do we tweet? Like where do we go? Like a tweet section or something?
Yeah, we'll come around and help people. And if you could pair up, and anybody who's used it before, help people who haven't used it before too. We'll, Eric and I are going to circulate now and help people out. Hashtag case scholars. Oh, you got a picture too.
No, this is not me.
Oh, that's not you? Oh, okay.
Where does my tweet go?
Okay, you did tweet?
I did.
Okay. So now you want to search for it, or you want to look at it?
Actually, what would be really meta would be.
Are we seeing like is this the
No, it
K?
does.
This is it.
But like,
To the bottom? Okay, so scroll
can you
wait,
see
wait.
yourself tweeting?
Are you following a bunch of people?
This is a
Okay,
live.
so that
Oh, so mine it didn't work.
So if you go slowly, you'll probably
So I
find
just
it.
tweeted
But I
mine.
But if not, you can go to yourself and you can.
Oh, I didn't put my
make sure it-
hashtag.
There you go.
Yeah, this, I love this.
Good.
What do I do?
So
There.
just hashtag.
Uh-huh.
Never
Italicized. Times, okay now.
It's
Alright.
more just,
Yeah,
and
and
this
it
is
should
part
pop
of my
up
whole
there.
distress with the whole thing, how did that
Alright.
photo
We
become?
probably said, we probably used it at some point
That
for
photo had
something.
not been taken at the point that you and I.
Questions about getting on? Should we continue? And you can do without the hashtag too, and it just pulls up everything that has the word K-Scholars in it. And we can go to all users and just pull them all up. And everybody who wrote the word K-Scholars should be on this list.
And you can all follow each other now because you can see each other by searching.
So the third reason we're going to tell you is what we already discussed of why you should do it, is staying informed. This is kind of both a lurking function, but it's also really good. Nobody can keep up with all the medical journals that are being printed right now. It's hard to, especially with all the different venues for publication about the subject matter that you're interested in, how to make sure that you're actually seeing the most important articles. And this is what I use Twitter mostly for, is I want to stay abreast of all the things that are happening in my field. And I can get the top 2 journals, top 3 journals in my field. I probably won't read all of them. So how do you know when an article comes up in a journal that's really important to you? And this is why I use Twitter for, is I want to see what people are talking about. It's just a way you can kind of use it to filter all that information that's coming out there to see what people in the area that you're interested in are talking about. So I follow, again, the hashtag HPM and the hashtag geriatrics to see what people are actually talking about. So I'm not missing important articles. Ken Kavinsky, one of the researchers in geriatrics, great person to follow as far as talking about articles that are coming up both in journals but also in the press. And it's also a great way to actually meet other people, including journalists who often have picked up our stories that we tweet about and ask us to actually talk with them to reach a much larger audience. So I'm going to just tell you quickly a little bit about our story, about where we started from. Is that, how many years ago, Alex? 2009. We got together thinking about our division website and how we wanted to change our division website and how we wanted to actually talk about things that we cared about on our division website, but also realizing that it's probably not the best place to put controversial subjects or subjects that you want to actually move conversations forward. So we decided to create a blog called Geripal. That was like the 7th incarnation of the actual title. And you can see we started off pretty small. I forget how far down. This was in September of 2009, so several months later. We had 129 people who were signed up for our email lists and had some people following. But the main thing is we just started doing it. And it grew, kind of grew slowly. This is just people who, this is actually page views per month, is that we got page views. And the nice thing is that it was the people that we actually cared about. So we did a survey of our audience. We found that, and again, what we heard about in the beginning, kind of who was our audience. Our audience that we were really aiming for is healthcare professionals interested in geriatrics and palliative care. Not a huge audience, but an audience that we wanted to create a community for. You can see that we had about half of them were nurses, a lot of doctors, we had some social workers, some students, we had a couple chaplains pop up on the list. And the nice thing is that people were actually coming to us and listening to us, and we started actually making a little bit of a name for ourselves. And the other thing is that they weren't the usual subjects of just us, academic medical centers. We had a lot of people in community hospitals, home hospice, long-term care facilities, academic clinics, home care. These are people who are hungry for information. A lot of the stuff that we put out there is blocked behind paywalls, not easy to get to. This is a great audience that actually we can impact how we care for patients by reaching them. And this is just one example. And there's lots of different audiences out there. And these people generally found us either very valuable or extremely valuable. Some people, interesting why they filled out the survey, but they did found us hardly valuable or somewhat valuable. So I think we were having some impact. So we grew and we started actually making it prettier, so we added pretty pictures, and the content stayed the same. Making it, and this is not a journal content. This is 3 to 4 paragraphs about something that's important to you, or about a recent article that came out. And we've grown, so every month we've grown and grown. Now we reach about 60,000 page views per month. Again, not New York Times circulation, but we're not aiming for the New York Times. We're aiming for healthcare professionals and geriatrics palliative care. And then the other nice thing is that it's a way that we can start advocating, because the audience is now not just healthcare professionals.
So let me tell you a little story. Well, I'll start off with a question. What was the most influential statement that affected legislation in palliative care in the last decade? You know?
Death panels?
Death panels, yes. Does anybody know where that death panels comment first appeared?
Sarah Palin?
Sarah Palin's Facebook page. Death panels. So it's appeared in social media. That's where it first appeared, Facebook post. So we wanted to counter this message with a message based on science and ethics about the important role of prognosis in clinical decision making for older adults. So we wrote a systematic review about prognostic indices for older adults, so we could figure out like what tools do clinicians have to estimate prognosis for older adults. And actually, I developed that with a lot of help from the case scholars, because our 11 to 12 seminars used to be sort of topic focused, and one of them was prognostic models. I think we presented this 3 or 4 times during that group. Got a lot of advice, so that really helped this research move along. And the first author there was a med student. She actually came and presented to the case scholars on a couple of occasions. It was great. So we identified 16 non-disease specific prognostic indices, and we evaluated them for accuracy and generalizability, published this in JAMA. And then we did something that most people don't do. We actually created a website called ePrognosis, where you could access all these prognostic calculators for older adults. And each bubble here represents a different prognostic calculator. And you can see the size of the bubble corresponds to how often people click on it. And we evaluated them for quality and in terms of time frame. And we launched this website the same day that we published the paper in JAMA. And we had 500,000 hits in the first week. And a lot of that is because we had a lot of press. We developed established relationships through social media with journalists. So Eric first was contacted by Pauline Chen from New York Times through Twitter. Is that right?
Yep.
And then Paula Spann is another journalist so Pauline Chen writes for New York Times, and Paula Spann also writes for New York Times. And did she find us through social media?
Yep.
Do you remember the story, or did she read a blog post or something?
I think she started reading our blog posts.
Yeah, and she reads our blog posts regularly now, and she writes a story about it, something from Geripal maybe 4 times a year, something like that.
Yeah, and occasionally the nice part is, like, Ken talks about an example where I think statins they were trying to put over the counter, and Ken wrote, no on Twitter. And like within an hour he got a call from Paula Spann from the New York Times asking if he'd want to be a part of a story about statins going over the counter. So it's also one of those things, you do have to be careful about what you write, because you may get a call from the New York Times an hour later asking what you meant by that.
So we're also in USA Today, and then I wrote a companion piece in New England Journal arguing that clinicians should offer to discuss prognosis with older adults, and Paula Spann wrote about that in New York Times, and this got like a zillion hits. And then I was invited to the National Academy of Sciences because somebody read about our studies in the New York Times to give a talk there. So we leveraged our research and scholarship to change the debate on a national level about the importance of prognosis in clinical decision making, from one based on rhetoric to one based on science and ethics. and that was our goal. So we also feel that we have a responsibility to respond to messages in social media, because social media is a platform for dissemination of messages. Whatever field you're in, there is some sort of controversy, and there are people who are taking stands, and you have the opportunity to shape the message yourself through social media, and you also have the opportunity to work with people who are in traditional media outlets who read social media and are looking for like important, prominent researchers or hotshot, up-and-coming people at UCSF like you guys to help generate stories. Yeah, so that's what we got. Questions or comments? Before we're going to turn it back over to
I
Nushin.
just wanted to
for
say,
today,
I
but-
just wanted to say, I think
Yeah.
you guys have done a brilliant job. I mean, you really leveraged the tools of social media in a very intelligent and thoughtful way, and brought attention to the questions that were important to you, and were thus able to participate in a national dialogue. And I think, you've really done an awesome job using exactly these tools.
I think it's part of the larger kind of, when we're thinking about the things that we're trying to do within our division, is that we don't have a formal strategy, but we do have a strategy of promoting each other's work. So when Alex publishes something, I try to make sure to write about it.
And vice versa.
Vice versa. So we're actually building each other's work. And, we wouldn't have gotten this much press on it if Alex just stopped at submitting it to JAMA. It was a great article, but you probably wouldn't have gotten the press that got him to the National Academy of Sciences. If it wasn't for all that kind of legwork to build up those relationships with journalists, and also to make sure that we're in charge of getting our word out about the things that is important to us.
We're going to share this with a larger audience via YouTube, and I know the question might come up, which is time commitment. Like, who has time to do this? So if you could address that, that'd be great.
Sure. So I just wrote a blog post this morning. It took me I wrote a blog post about, it's Nurses Week. So I said we should all thank the nurses that we work with, and I wanted to focus on nursing scientists this week, because often we usually write a Geripal post about Nurses Week. And so this year that was a specific focus. It took me about 45 minutes to write the post. I'd say that when we started, it probably took me like 2 or 3 hours to write a post. Now I'm down where I can crank out a post, in an hour, sometimes 2 hours if it's, takes more work if I'm reviewing an article, for example. But oftentimes I'll take what we've discussed in Journal Club and I'll write it up. And that's pretty easy to do because you've already done all the legwork, right? You've already been through the Journal Club. And the other thing we found over time is when we started writing blog posts, it was, New York Times length, JAMA length blog posts. And we didn't get many people reading them. And then we realized that our most read posts tended to be shorter, like 2-3 paragraphs, bullet points, really clear. So we try to be more USA Today than New York Times as we're writing blog posts, and we've really expanded our readership.
I think the other thing to consider is how long does it take to draft or publish an article? From start to finish, a year or longer. You put all that work into it. The ultimate goal to get it out into a good journal, and for people to read it, and for have some impact. I think taking that next step too is thinking about how do you create even more impact than just getting in the journal, where a lot of people, if you're like myself, you just can't keep up with everything. How do you highlight the fact that your article came out and you think it's going to be an important contributor to the literature? So I think if you're going to do all that work over the course of a year or more to get something published, spending a little bit of time just to make sure it doesn't just stop with the publication, but that you're spreading the word about something that you think is important, I think is well worth it. I think the other thing is that it can also save time for me because I don't have to read every journal article. Part of what I use it again is for the filtering component is I want to see what people are talking about. the articles that are really kind of rising to the top. So, I may miss some, but it's just one way that I can actually, filter through all this information that's constantly bombarding us.
Sounds a lot like open data, like what I'm hearing, your explanation for why Twitter and why use it to push publication and sort of bring you to like a different type of conversation. It sounds very familiar to the conversations around
Open access?
open access,
Mhm.
and why why that.
Yeah, so how many people have like published an article and it's been read by like 10 people or less? I remember I published one with Ann Kelly about length of stay in nursing homes at the end of life. So how long are people in nursing homes before they die? And it's been cited by 11 people, and half of them are me. But Eric wrote a Geripal post on it. And it's one of our most read posts in Geripal. Because people want to know, how long am I going to be in a nursing home before I die so I can plan for the future? Academics may or may not care about it, apparently. But certainly get the message out there. And that's part of the goal of our research, is not just to add a number to our list of publications, but actually to change things and improve care and all that stuff.
So for instance, there was an article that came out about again, specific to my area, of the dangers of fleet enemas in elderly patients. If you Googled fleet enemas before that, that article would not be on the top. And maybe a couple people like me read that article, but it wasn't in a big journal, so not a lot of people read it. We actually wrote a Geripal post on it, and you Google right now fleet enemas, it will be one of the top 5 results that come back. The makers of fleet enemas are probably very angry at that fact, but it's just the way that I was actually able to amplify that message of the person who created a really wonderful piece of research about the dangers of this medication. And again, that's kind of how we work collaboratively with our colleagues to really spread the word about really important literature that's coming out.
One final question. I know on your blog you do have some guidelines about professionalism and negativity on posts, and Kevin, feel free to chime in if you have anything to add, but just if you have UCSF, your description or your handle, what does that mean?
Do you want to answer that?
Well, just for your own standards, do you have your own personal standards? Are you following some kind of medical guideline practice?
So I think about, it's like if you just treat social media like you were on an elevator in a hospital, you'll be fine. If you shouldn't say it in an elevator, you shouldn't say it on Twitter. On an elevator, you're a UCSF employee. Whatever you say there could also bite UCSF later on. And it's just another place we're having conversations. It's the same thing with social media. So I use my Twitter account and I use our blogs. They're independent from UCSF. We say at the end of our blog that it is independent from UCSF, but I realize I am a UCSF employee, so that there is a connection. Plus, I'm a physician, so I have other responsibilities too. So I just make sure that I follow that general rule. If I wouldn't say it in the hospital, on an elevator, with other people in the elevator, I shouldn't say it on Twitter or Facebook or.
I think it's just like anything else. You want to enter a new room with new people. You want to get familiar with your surroundings. And I know we said first step is to start a profile, open up a profile. There's that, you have to get over that inertia. I think everyone here understands the outcome or the benefits of having social media, but if you get over that inertia, there still is going to be that curve of engagement. It's okay to be a lurker at first. I think the woman that's sitting over there was worried about, well, what if I have a profile and I'm not active on it? Does that look bad on me? I think that was one of her concerns. But just like anything else, you have to start somewhere. And starting point is to start a profile, and it's okay to be a lurker at first, and after some time you'll understand what kinds of conversations happen there, and you'll start talking in the elevator, and then you'll start getting more comfortable with what you can say in the elevator, and it's kind of the same thing.
And I think about the conversations as kind of as like a river going by. You don't have to look at every drop of water on that river. You can leave for a month and come back. Don't worry about everything that's passed. It's just about in that snapshot of time that you're in that environment. So as I'm walking down the hallway, and I often look at Twitter just to see what's going on right now. I'm not going to look what happened 5 minutes ago, or I'm not going to worry about all those things that are coming in. It's just right now what's going on in the areas that are important to me.
And also adding to what you said, what I did when I first went on Twitter, I wasn't quite sure what the environment was and what was appropriate. And being in charge of a kind of a big account for the UCSF School of Medicine, what I did was I first went on as myself. And I just kind of listened, I looked around, I looked at what other people were doing, and once I felt I knew kind of what I was doing, then I started the School of Medicine account and sort of did my official tweeting from then on. Since at that point I had a feel for Twitter, for the tool, and for the messaging out there and what was appropriate. So that's one way you can sort of dip your toes in. You know, you can kind of have a test account, kind of check it out that way before you go in sort of officially.
Does anybody have another issue that often comes up is promotion? Like, so I actually presented some stats. So I was transitioning from the adjunct series to the in-residence series, and you actually have to go in front of like a panel of people. Like Ralph Gonzalez was on the panel, and like talk about your research. And I talked about my blog. I was like, here's Geripal, you know, we started this blog and it's grown and all these people read it. And they were looking at it and they were squinting. Like, what do we do with that? You know, like, it's not publications, it's not grant money, it's completely different to them. And they really, I think that if you're doing this purely for promotion purposes, that's the wrong purpose, because I don't think that promotions committees actually know what to do with it yet. But what does translate is national reputation. And when you get invited to get, you know, talk to the New York Times, you know, like 8 times or whatever, and that's on your CV, that counts. When you're invited to give talks at meetings, you know, national meetings, because of your expertise in social media, that counts. That goes towards national reputation. And it also helps when you're spreading the message about your own research and your own research agenda on a national stage. So it really does help to amplify your message. I think like the exact metrics of, you know, what is like being one of the top, what are we, like medical professionals on Twitter, top 50 something? Like that doesn't mean anything to them. But those other things do.
And just getting people to talk about the subjects that you care about, and getting people to actually talk about your research. It can lead to these other things like National Academy of Science talks or other talks that may have more weight in academics.
Nushin, is there anything you wanted to say to wrap up?
I think you guys addressed all the nuggets we were hoping you would, so thank you so much. Any other final questions, comments? Thank you so much for your time.
Thanks everybody. See you on Twitter.